For those of you who don't know me, I'm Dr. Gary Kaplan. I'm hoping all of you here have read my book, seen my book, know about my book. What the book does, and I hope you'll read it if you haven't had a chance to, is it really outlines our whole philosophy of care here and a whole different approach. One of the things that we have to change in our thinking in medicine is we have to change from thinking of things like depression and chronic pain issues from being diseases to being symptoms. And that's a major shift in our thought processes. Because as soon as we stop thinking of them as diseases and we start thinking them as symptoms, and what they're symptoms of is an inflammation in the brain. They're symptoms of a neuroinflammatory process going on in the brain. So if we start understanding that, then we get to step back and say, okay, well, wait a minute, what is it that causes inflammation in the central nervous system? And that then leads us into a whole cascade of different questions and different diagnoses. And typically what we find is there's an accumulation of events that have happened with people. So we have a couple of things that we've learned in the process of this. One of the things is that it didn't start when you think it started. That frequently what's happened is what you're looking at is the end result of a long process of accumulation of assaults that have happened on your system that have never been completely resolved. And secondly, what you think you have may not be what you have. So the classic example is a patient of mine who came in with migraine headaches and anxiety disorders. She was being treated by a psychiatrist for her anxiety disorder. She was being treated by a neurologist for her migraine disorder. And what she actually had was gluten intolerance. Not true celiac disease, but gluten intolerance and a leaky gut. We treated the gluten intolerance, we treated the leaky gut, and the migraines went away, and the panic disorders completely went away, and that was it. So sometimes it gets a little simple, but we have to know what set of questions to go after. Sometimes it's considerably more complex than that, if there's Lyme disease and co-infections and other things, but it's about looking for all of the things that create the problem. Now, one of the things that is also a symptom or potentially a cause of neuroinflammation in the central nervous system is sleep disorders. So a highly fractured sleep pattern, that is difficulty waking up multiple times during the night, okay, disrupts your circadian rhythm, disrupts your hormonal balance in your body, and will cause inflammation in the central nervous system. That can also be a symptom, however, of inflammation in the central nervous system. In addition, if you have trouble falling asleep, and we're talking serious latency, anywhere from, and latency is defined as anything past 20 minutes. So if you go to bed and it's taking you longer than 20 minutes to fall asleep, you have significant latency. So if it's taking longer than 20 minutes to fall asleep on a regular basis, there's a problem. Now, sometimes that problem is just excessive worry, but I will also tell you that we know that chronic stress, okay, especially stress so much so that it's disrupting your sleep, is neurodegenerative. It causes damage to the central nervous system, sets off that inflammatory process in the central nervous system. So we want to be doing things that will relieve stress in the system because we know that chronic stress causes damage to the brain. Additionally, you can have problems with sleep apnea. All right, sleep apnea is where you think you've had a good night's sleep, except that you're exhausted when you wake up in the morning, you're falling asleep multiple times during the day. And you're having trouble staying awake despite the fact that you got 8, 9, 10 hours of sleep. Sleep apnea causes loss of oxygen to the brain during the night. That is inflammatory. It's just damaging to the brain. And that's inflammatory, and that will cause an inflammatory reaction and the symptoms of depression and the symptoms of chronic pain in people, or maintain them. So these are the things we have to go looking for. Now, the catch is we have a huge number of people taking sleeping pills every night in this country. What we don't bother to tell people, the literature tells us, but what people don't understand is that the use of sleeping pills on a regular basis actually can potentially lower your lifespan. We know that as little as 2 to 3 times use of sleeping pills a week over a course of years will actually causes increase in all-cause mortality in individuals, from cancers, from heart disease, from strokes. So we'd like to get you away from that, because clearly, and we don't understand what the process is, but the literature clearly tells us that chronic use of these kind of sleeping aids creates problems. So our goal is then to see what we can do about treating this at its root, at the root cause. And the beauty about acupuncture is that it steps back and takes a whole different perspective on you and looks at you in context. So it doesn't just see the sleep problem, but it sees the sleep problem in context of all of you. And it has a completely different way of approaching the problem and creating rebalance. And that's what Rebecca is going to be talking about tonight. There are herbal approaches in addition to the use of acupuncture. Rebecca came to us, she was once upon a time a student of mine at the Special Master's Program at Georgetown in Complementary and Alternative Medicine. She chose to go the route of becoming an acupuncturist. She had the option of becoming a physician, but her heart, her passion really lied in acupuncture. And she went out to Bastyr, which I think is the oldest naturopathic college in the country. Oh, yeah. It's certainly the best naturopathic college in the country. I've had an opportunity to lecture there, and I know some of the faculty members there. And so she got a really outstanding education in acupuncture and herbal medicine. So she came to us with these incredible strengths and has been a real huge addition to the practice. It is my pleasure this evening to introduce Rebecca, and she's going to teach about acupuncture and treatment of sleep disorders. So I welcome you, and I hope you get a great deal of information out of the lecture.
It's really a great introduction, you know, both to the topic and also to the clinic. I'm one of the newest members of the Kaplan Center team, and I couldn't be more thrilled to be here along with Dr. Erica, who's in the back corner there hiding. You know, because you know, being here gives you know, me the opportunity to be part of the team, and so not only to address you know, issues with acupuncture, but you know, along with everyone else, really treat the root cause, you know, in areas that I really wouldn't be able to touch upon. So I'm really glad you guys came out tonight, even though it's a beautiful summer evening. But this is a, you know, really important topic. Some of you may have been at my lecture, I guess that was in February, and the biggest response that I got back about that lecture was probably, you know, a 1 minute period where I was talking about sleep from a perspective of Chinese medicine. I just got a lot of feedback, and so from that I decided to do an entire lecture about that. So with that, what we're going to be talking about is a little bit of an introduction, also kind of piggybacking on what Dr. Gary was just speaking of, talking about acupuncture research, and then really the meat of the talk is going to be in the different patterns of Chinese medicine and what those mean in terms of sleep and sleep dysfunction. We're going to talk about sleep hygiene, so the things that that you can do, you know, outside of acupuncture or supplementation or medication, things that you can do for free, you know, in your own homes that will really have a huge effect. And you know, even if you're you know, trying to help yourself through any of these interventions, the sleep hygiene is just a huge part of that. I'll review with you the Epworth questionnaire, which is something that Dr. Gary alluded to, and then we're going to end the evening with a demonstration of an acupuncture treatment for insomnia. And then, so I ask you to save your questions till the end. So, you know, what is insomnia? It's difficulty initiating or maintaining sleep or non-restorative sleep for 1 month. This is coming out of the DSM-4. And it's important when treating to differentiate it from kind of temporary stages. Certainly, and every new parent is going to have some sleep issues because they have a child who's waking them up. Or if someone has periods of you know, emotional upset, or you happen to have coffee late at night, these aren't, you know, really periods of you know, any chronic issues. But people who do have insomnia will have impairment of daytime functions, impacting energy, mood, difficulties in concentration, fatigue, work efficiency, and then it continues, to have really large health impacts. 2002 Sleep Foundation study found 35% of Americans suffer from insomnia. This is a huge, huge number. And this study was actually 1,000 people, so it was a very large study, and the prevalence is more in women, and it actually increases with age. And there was a study that showed that women between about the ages of 40 and 60, the most common symptoms was waking at night. So this is a subset that doesn't have trouble falling asleep, but staying asleep. And we'll see that coming up with the Chinese medicine patterns as well. 78% of chronic pain patients have difficulty falling asleep. Again, this is, sleep is needed for that restoration, for healing, and the fact that people aren't able to fall asleep and sometimes become dependent on medications for that can be an issue. But you're not alone. About 5% of adults reported using some form of complementary or alternative medicine to treat insomnia. So what does sleep do for us? Like Dr. Gary mentioned, we really don't know all the benefits of sleep, but certainly there's a huge component of learning, mood, attention, making decisions, creativity that will actually increase with healthy sleep, maintaining a healthy weight, and healing and repair of tissues, including heart and blood vessels. Having a strong immune system, safety, a lot of accidents happen every year from lack of sleep, and really the list goes on and on. So what does acupuncture do? Research of acupuncture has shown that it reduces the latency, how much time it takes to fall asleep. It increases sleep duration for those who need to sleep longer. It can increase the quality of sleep, getting into those deeper stages of sleep. And a study compared acupuncture to some conventional medicines and found that it was either as effective or superior to those medications in terms of daytime functioning. And the postmenopausal women. It showed an improved sleep quality. And what's interesting about that, if you kind of think about what this intervention is, you're talking about during the day, the insertion of small needles, into the body, for it's a 1 hour treatment, and then that evening and for the rest of the week, you're talking about having increased sleep, and deeper sleep. It's pretty incredible. We're not talking about, pharmaceuticals. So the mechanism of action, and I also have these studies, is, and these are basic science studies. It's kind of interesting. They'll actually do acupuncture on rats, specific acupuncture points, and show these physiological changes. So we're calming down the nervous system, reducing cortisol, so helping to kind of rebalance those sleep-wake cycles. Acupuncture has a sedative effect. If any of you have had acupuncture before, you know that during a treatment, generally, people feel really calm. You might feel like you even had a nap during the treatment. You might have actually fallen asleep, and this is because of the GABA levels have been increased. It does have an effect on melatonin levels, and then an increase in rapid eye movement. These studies definitely need to be replicated. The acupuncture research is fairly new. There really needs to be a lot more research about these, and I'll go into some of the issues with clinical research. But this is what it has been shown could be a mechanism of action. At this point, we really don't know how acupuncture exactly works.